Hey, I'm Aiden with Paradigm Medical Systems. I'll show you some of these products here today. Let's start off with Sophie and her mom right here. So we've got the Sophie fetal model here. She is a full birth weight fetal model with a fully articulated skeletal system. So all those joints bend and move like they're supposed to. Her mom here also has a replica bony pelvis embedded into the model. So between kind of the materials that these are made out of, which is very stretchy and durable and lifelike, and between the skeletal structures that are inside of the models, you get a really nice accurate fit between the components. Great for your basic hand skills, but really awesome for shoulder dystocia and breech in particular, since it's got those bones where you can actually properly set up and then resolve a shoulder dystocia. So I'm going to push this baby through the model here, and what we're going to do to set up a shoulder dystocia is get this upper shoulder lodged on the maternal pelvic bone there, and then you can modulate how difficult the posterior arm retrieval is going to be. You know, you can do any of the maneuvers that you normally do to resolve a shoulder dystocia. My favorite one is the posterior arm retrieval, and you can modulate how difficult that is based on where you have this arm placed as the operator. So if you got something that's just kind of learning how to do the shoulder dystocia or the posterior arm retrieval, you can start it off kind of in the front here, whereas if you spin it by the side, it gets more difficult. Put it behind the back, more difficult again. So I will show you how that works real quick here. Get the model lubricated, and it's manually operated, so I'm just going to push down into that curvicaris, and then Sophie's going to start to crown here. And then shoulder dystocia, we just retract to give you that turtle sign. And as the operator, I manipulate those arms internally to make sure they're in the right place. I don't have anyone here to deliver the baby, but you'd take your hand, you'd go in posteriorly, and you'd try to sweep out that arm just like that. And that will release that anterior shoulder so you can continue with the restitution and the delivery of Sophie. And there we go. And it's, like I said, great for your basic hand skills too. If you're just trying to, show folks how to slow the descent of the fetal head, or where you're going to place your hands in order to catch and deliver the baby and stuff like that. You can also run some other simulations with Sophie's mom in terms of accessories. We've got a manual move of the placenta kit, which you can use these components together to do a manual placenta. You can also use them separately. The boggy postpartum uterus will accommodate doing uterine inversion, postpartum IUD placement, and the placenta can be used to do up to a double nuchal cord around Sophie's neck. And then we also have a postpartum hemorrhage uterus, which I don't have here, but it looks like this, and it's got tubing for low bleed and high bleed. And that one will do, postpartum hemorrhage simulations. You can use that with a Bakri balloon. You can use that with the JADA system as well. The JADA system can be used with this uterus too. If you use it with the PPH kit, just make sure you clamp one of those tubes so you can actually create suction. But both those uteruses are compatible with JADA. All right, and then in the middle here, we have got the gynecological trainer. This one's going to do really realistic pelvic exams. Again, kind of an array of basic skills there. Where they're doing speculum exams, bimanuals, rectovaginals. You get 7 different uteri pathologies. So you got small, medium, large, retroverted, cyst, fibroid, and hollow. The hollow one here is going to be used for IUD placement and retrieval primarily, but you can also do pap smears, cervical ripening. I got a couple folks that like to use it for hysteroscopy as well. And then you can kind of get creative with our stuff. A lot of the time, it just tries to mimic human anatomy as closely as possible. So certain stuff that we didn't necessarily think about, like pessary placement, works really great for. Then we've got Lucy and her mom down here. This one's also going to be a delivery trainer, but it is specifically for vacuum and forceps. So you've got a fetal head that was designed by Dr. Aldavaca based on measurements taken throughout his career. He created the Kiwi cup, and then wanted to create a model that was going to work really well for simulating how you place that. This model also has a full replica of the bony pelvis inside of it. The lateral sidewalls are a little bit tighter, and the pelvic floor is a little bit higher than in Sophie's mom for creating that optimal environment for vacuum deliveries. Because of the construction of that bony pelvis, it also is fabulous for forceps as well. They interact with the model in a really nice, natural way. Stay in place where you put them, and overall, really great experience for those two very specific skills. We also have Charlie here. Charlie's mom I don't have with me, but she is like these two smaller models in terms of her construction. Inside of Charlie's mom, you're going to have a vaginal canal with rugae, like with this model, so that it feels very accurate when you're going in to do your exam. He is going to do station dilation and effacement with 3 different cervices. Each cervix will dilate out to whatever kind of presentation you want to be working with. So whether it's the multipara cervix here, the primipara cervix, or the edematous cervix, each one of those can present kind of however you want them to. This model will also accommodate fetal scalp electrode placement as well as assist rupture membranes. So you do get a couple of other features with that one there. And then the last model I've got is the perineal repair simulator. This model comes to you intact, and then you cut it to whatever degree and location of tear you want to be simulating. And there's some muscle and mucosa that runs throughout the model, so you can locate that tear anywhere you'd like to. You only cut the model once, but then you can stitch that cut up to 200 times, kind of depending on the severity of the tear that you're dealing with and the repair material that you're using. But overall, again, just kind of trying to bring the highest level of tactile realism to a specific skill set and kind of bringing that type of simulation up to a higher level. So, yeah. Great. Well, I think that covers just about everything. Thanks for stopping by and taking a look at our stuff.